Good morning. Uh, I want to thank Dhiren for inviting me for this event. This is a very important topic what we are talking today here, and especially on the issue of, since we have a new government in the country, so what should be the way forward, how government can collaborate with private sector. That is something which is very critical, and this is an important topic on which we have to see what can be done by this government. If we look at the healthcare landscape of India, the biggest challenge which we face today is the fragmentation in the sector. So there are so many different ministries doing different things. There are state governments, they have their own priorities, central government has their own priorities. Because initially there was only supply side financing which was there in healthcare, where government was setting up these facilities and the people were getting free treatment, but beyond that government started health insurance programs and all, which further created fragmentation, because at many levels they were working parallel or separate to the healthcare function of the government. So this is a very critical time, and we have to see that how actually a holistic framework can be developed by the government, so that they can bring all these different things which are happening in parallel together, and then try to deliver a healthcare product and a healthcare solution which is available across the country and which is available to everybody as per their need. And the role of public sector also will be very critical in this, because the public sector delivery system, which is working right now on a path which is there since they have taken in post independence, is the same way that you get your salary, you have to perform some functions, whether you perform or not perform, the accountability is not very high, and how good or bad you perform, again that is something which not always is measured. But now there are enough evidences from across the world where you can see that how public sector itself can be reinvented. You can bring different kind of systems to actually make them more accountable. For example, pay for performance can be added. In many countries they are doing it. In India also, in the health insurance scheme, this pay for performance system has been brought in, where based on the volume the health center generates, there's an incentive for the staff of the public hospital. And that is something which is again a very critical thing, where even in the government domain, how actually you measure the performance and how you incentivize the performance, that is something which has to be seen. And it's not necessarily always a monetary incentive which we are talking about, but the incentive in the sense that which brings the accountability into the system for the public healthcare system is again very critical. And the next is the private sector, because the private sector has played a very important role in the country since quite some time, and they are expanding. So government cannot ignore the private sector and say that no, we will only try to use the public sector and deliver and put our resources only behind the public sector. Experience from across the states have shown that private sector has a very important role to play, and not only in the tertiary care, even in the secondary care. And now there are a lot of exciting startups you see which are working in the primary healthcare domain also, where they have brought interesting technologies, where they have brought interesting ideas on how to even deliver primary health care at a very reduced cost to the masses. So the role of private sector will be very critical. One of the major, I will not say drawback, but one of the major challenges which the country faces for the private sector engagement is the lack of any regulation, because there is no regulation to see that what the private sector hospitals will do, what the private sector healthcare providers will do. So that is something which has to be seen. We had a Clinical Establishment Act which was brought in, but it is in very early stage. So we have to see that how actually we rope in the private sector, but at the same time we have a certain degree of control the way they deliver the services, and that is something, this balance needs to be found, and that is very critical, that how the government will do it. Now this new government is talking about national health assurance. They are saying that we will provide a set of assured services to each citizen of the country, and not necessarily always financed by the government, but at least this national health assurance will be there. Now in the discussions with the government, what we see that this national health assurance still is a fluid concept. It has not yet been defined very clearly, number one. Number two, that even if it is defined very clearly that what assured services we will provide, how they will be provided suddenly through an assured system is something which is not yet very clear. Because even if we say that okay, now we have these 100 defined services which government will provide free of cost, that is what anyway we say now, that we don't assure it, we don't say that these are the defined services, but we say you go to public healthcare facility, it's free. It's not always free. And that's where the big challenge will be, that how do we ensure that these services which the government is talking within National Health Assurance are actually provided. And for that to be done, there's a huge, I feel that there's a big reorientation of the current system has to be done, especially at the primary healthcare level, because at the primary healthcare level we have a system which is mostly based on PHC, primary health center level, and from there you go to CHC and then upwards. But it becomes too far from the patient. So from the beneficiary level, many countries across the world, whether it's Thailand, whether it's Turkey, whether it's Colombia, they have shown that how actually primary health care can be delivered when you bring it much nearer to the beneficiaries and you make a set of people accountable for a set of population. So which means that you have a government is talking about a revised sub-center or a wellness center or whatever you call it, but a set of, let's suppose for a 5,000 population, I have a set of healthcare providers who are responsible. So they become the first step shop for all these beneficiaries in that area, that for those 5,000 people, they have to go first there, and from there only they will get referral. But only saying that now you go there will not solve the problem. You have to make that center also equipped enough to carry out different kind of activities, and that's where the technology will play a very important role. That how the technology will work there, because now, for example, there have been technologies in the system which are able to actually link at the field level, at the village level, with the through telemedicine or through different kind of technologies, with different set of doctors, with different set of high level facilities, and that is something which is very critical. And that's where I think at the national level it will be very critical for Government of India to have an institution which actually will lead the whole process, because right now it's a very fluid thing, citizens, and that's where it's very critical that a strong institution is made at the national level. And across the world we have seen that countries have set up these kind of institutions wherever they have gone for this big reform, and that is something which is very important, which government has to do here. And that's where, as I was talking about, the reinventing the primary care sector is something which will be very critical, because the focus has to go to the primary care, and the focus has to make sure that as much preventive and promotive we can do, as much as early we can detect the issues and we can sort out those issues, healthcare issues, that will be more beneficial for the country than waiting for the people actually to fall sick and go to the hospital and then focus on the curative part. So that is where it will be very critical to reorient with the primary healthcare center, with the primary healthcare level, and how to actually improve the referral system, that a patient you can actually track. You can see that which point the patient enters into the health system at the primary care level, and how the patient moves through the secondary care, tertiary care, and that's where this whole technology of electronic health records and these kind of things will come, where the doctor will have, if you actually implement it, then doctor will have much more power at their disposal, because then they can actually see what was the medical history of the patient, how the patient has moved, where they got the first treatment. All these things become very important when you have a very clear referral system defined. Otherwise people can decide to go at any level of care, and that's where you see that there is a lot of load even of the outpatient care at the tertiary care hospitals. So you see that in many countries it's not there. In many countries the maximum load that people come at the first point of stop at the primary healthcare center level, but in India people can go anywhere, and even for a headache they can just go to AIIMS and say that I have a headache. So that is something which creates unnecessary load at that level, and which could be certainly be taken care of. And that's where the role of ICT becomes very important, because when we are talking about ICT and when we are talking about providing solutions, so that's where information technology has shown that they have developed solutions to tackle many of these problems. For example, how do you identify the beneficiaries? How do you see that actually the treatment which is being provided, you can track to the beneficiaries? That is something which there are enough technologies available which have done it. And how do you verify the patient at the hospital level, whether the same patient is getting the treatment or not, whether the patient which is getting the treatment is the same patient whose name is there or not. All these kind of things you can do, and then technology is able to develop the data, in the sense that the data which is generated at the hospital level, right now in India the data is a big issue. Not much data is available even with Ministry of Health. If you ask every year how many citizens suffer from a particular disease in the country, including private and public sector. There's not much data available in the country. And that's where if you bring the IT in a nice way, if you actually connect hospitals through the IT system, then you can see that how these hospitals, how the government can have access to data which can be used for monitoring, which can be used for developing strategies. And that's where it's very critical that this information technology is used. And that's where the health insurance schemes across the country, whether it's the RSBY at the national government level, whether it's Arokshri at the state government levels, these schemes have shown that technology can be used very effectively. Technology can be used for identification, verification, registration, and at the same time technology can be used for treatment at the hospital level and how to transfer the data from the hospital to the government. And that's where role of insurance companies have also become very important, that government has been able to try to create a business model where they use the skill sets of the private sector, whether it's the insurance company, whether it's the hospital, whether it's the third party administrator or other agencies, and develop a kind of model where it's a win-win situation for everybody, where the private sector actually can get more business, people can get better access, government can get better implementation of the program. And that's where the health insurance industry is working, and that's where a big challenge is right now, how to take it forward, because right now even all the health insurance programs of the governments are basically focusing on poor and the vulnerable groups. They don't go beyond that, and that is where the critical part is. If government is talking about universal health care, if government is talking about UHC for everybody, then we have to see that how does it go beyond only the lowest segment of the society, and how do we actually make sure that not only them but everybody is covered through the system which the government wants. And another very important topic will be the quality, because even providing that care is not good enough. You have to ensure that a good quality of healthcare is being provided to people, and that's where the role of accreditation, the role of actually incentivizing qualities in the hospital becomes very important. In absence of a regulation in the country for quality, and also even if you have a regulation, in absence of the kind of enforcement we have in our country for regulations, it's very critical that we build quality in such a way that hospitals are incentivized to improve the quality. And that's where the incentive system comes, where the payers have demonstrated in many countries that they can incentivize quality. For even in India, in different health insurance schemes, like in Tamil Nadu scheme, they have graded hospitals in different categories, and then based on the grade in which the hospital fall, they get the payment. So if you're in a higher grade, you can get a little higher payment. Similarly, in RSBY scheme, the similar kind of system has been designed and being tested. So that is where actually government can in a way nudge the private sector also to look at the quality in a holistic way. And actually these gradings can be done in such a way that ultimately when you reach the highest grade, you can reach the accreditation. So that instead of becoming a 0 or 1 process for the accreditation, where you say either you are accredited or you are not, it becomes a stepwise process where hospital can take small steps and reach accreditation. And that's where again the issue of standard treatment guidelines, standard treatment protocols also come, which could be not only on theoretical on paper, it could also built into the technology through the system itself, where government can say that, you know, we can track data whether these procedures were followed or not for the treatment of defined conditions. Then the last point would be regarding the financing part, that how government can actually develop the whole financing system, where the money, because for doing this reform, huge amount of money would be needed. As per the last estimate, what recently came, government is talking about additionally more than 1 lakh crore rupees, which will be needed once the system stabilizes for everybody. And that's a huge amount of money, and government has to see that whether they have enough revenue on its own right now to put up that much money, which looks very doubtful, seeing the past record that we have not increased. At the time of independence, we were 0.9% of the GDP. Now we are 1.1% of the GDP. So we have not increased much in past 60 years. So thinking that suddenly from 1.1 it will become 2.1 or 3% of GDP is very optimistic. And that's where we have to see that what could be the alternative sources of financing. Can there be earmarked taxes for the healthcare? Can there be sin tax, as some countries are doing, where they tax tobacco or liquor and these kind of things? So or there could be contribution from the people also, where the families or people who can pay, they pay towards the contribution for getting a better healthcare. But the moment you start charging money, you have to ensure that the services are also delivered, because you can't do only one, that you charge money and then your services still remain the same the way they are. Then people will of course not pay. So that is very critical, and that's where for this whole region it becomes very important. But because in many countries in the SAARC region, there are these initiatives which are coming. The governments are trying to do these reforms, and it's very important that we learn from each other. We don't try to reinvent the wheel every time, because every country, what they are doing through a lot of deliberation, a lot of process. And if there is something good happening in any one country, certainly it should be useful to the other countries in this region, especially in the region, because there is a lot of similarities between the culture, between the people, the way we think, the governance structures and all in this region. So that's where I think there is a great opportunity for the countries in this region to come together and take health as a subject which is not only the problem of one country, but which is the issue which needs to be tackled for the whole region. And I hope that this event will be very useful in deliberating and discussing on these issues, and will provide some very useful inputs for the governments, not only for India but in different countries, which can then take further and improve upon it.